Hello and welcome to this lecture that is part of the Premier Skills Institute series on getting the cow ready for the breeding season. My name is Marijke Beltman and this is a lecture on uterine health in dairy cows. Before I begin, I would like to extend my gratitude to Dr. Osvaldo Bogado Pascotini, who is an expert in uterine health and has helped me get this presentation ready for you. So postpartum, what are the events? Well, none of you are very surprised in seeing these type of pictures with a calf being born, being out, and then being checked, and the cow and the calf potentially bonding. That is the first part of the process. What that leaves is a big uterus that has still a substantial amount of fluid and lochia in it, and that then needs to A, get smaller, and B, clean. And that is where the whole uterine disease aspect and risk factors come in. So what type of risk factors am I talking about? Basically, these all happen around calving and can affect the cow then later on. At calving, of course, you have calving difficulties. And then after that, there's uterine involution and the delayed uterine involution. Any type of metabolic disorders or metabolic demands of lactation could throw the cow off target and make sure that her uterus doesn't recover from parturition and develops some kind of inflammation along the way. It is important to realize that almost all cows have bacterial contamination of the uterus after calving. Actually, they have bacteria in the uterus before calving, but they're at a kind of nice balance and don't affect the cow negatively. And then after calving, there's an influx from external bacteria that can cause overgrowth and problems. The same immune system mediators are affecting both healthy and diseased cows, and the difference very much lies in the magnitude, regulation, duration, and effectiveness of the immune response of the cow to the inflammation and or infection in the uterus. During uterine involution, the caruncular regions of the endometrium are left unprotected. And whether or not this causes a problem depends on the regulation of inflammation, the load and pathogenicity of bacteria, and the efficiency of the innate immune system. And this will very much affect how the balance between, on one side, the contamination, and on the other side, the response will end up. If it goes wrong, you end up with the postpartum uterine disease complex. And this could be metritis, clinical endometritis, and subclinical endometritis. So just to make it complete, of course, there is puerperal metritis as well, which is the typical sick animal postpartum that is showing signs of toxicity. You have clinical metritis, not systemically ill, but still a dirty, smelly discharge. Clinical endometritis, basically pus coming from the vagina, 21 days or more after parturition. Subclinical endometritis, as it says on the tin, you can't see it directly. You have to look at uterine cytology. And as we know, pyometra, accumulation of pus with a closed cervix, but with the presence of a CL. What happens within a dairy herd? This is slightly older data, but not less accurate because of it. No disease and any type of infection presence. Basically, most cows will undergo some form of uterine disease. Whether or not they're affected and it affects their future reproductive performance depends on the severity and how much they can clear. So to start off with, metritis. Metritis is in the first 21 days postpartum. It means that all layers of the uterus are infected, so you get a big, dirty, inflamed type of uterus, everything is angry, all layers are involved. And you can see everything is also, there's a delay in involution, and all the layers are just involved in the whole inflammatory process. So you have endometrium, myometrium, and perimetrium all involved in this process. You can grade them. Grade 1, abnormal enlarged uterus with purulent or red-brown discharge, but not a sick animal. Grade 2, animal is showing some sign of illness. Grade 3, she is toxic. After a period of 21 days, we talk of endometritis. That means that instead of 3 layers of the uterus, we now have only 1 layer affected, the endometrium. So endometrium affected, still a large uterus, but the inflammation is only in the endometrial layer. So it's not all 3 layers, but just 1 layer affected that is inflamed. Healthy endometrium versus endometritis looks slightly different, and you don't have to be a histopathologist or a clinical pathologist to see the difference here. Healthy, nice glandular epithelium, nice uterine epithelium, endometritis, everything is a bit angry and a bit all over the place, in other words. Of course, we don't all have our histopath there and then. What we do have is vaginal mucus scoring. Clear mucus, we know, a bit of pus, and then as the pus increases, we increase our scoring system, and you can do this with a hand, but also with the metric check, and it will give you a decent indication of inflammatory processes going on in the reproductive tract. We call it, because we are scoring discharge from the vagina, we actually call this purulent vaginal discharge, not so much uterine disease, and more about this in a second. But basically, you are scoring, or we are scoring, any type of discharge that we can collect from the vagina. If you kind of go, okay, I want to see what the uterus is doing, of course, you can score it via ultrasound. And we distinguish then different categories from no fluid to a large volume of fluid. And these categories will have different scores. No fluid, spoke view, score 0. Large volume of fluid with a mixed cloudy echogenicity with some extra hyperchoric particles will give you a score 4. No fluid or small volume, score 1, small volume, score 2, and moderate volume, score 3. So that is uterine ultrasound. So we have now purulent vaginal discharge, scoring of mucus coming out of the vagina, and appearance of the uterus. The reason why we talk about purulent vaginal discharge and not necessarily about endometritis is because this vaginal discharge can actually have different origins. It could come from the vagina, being purulent vaginal discharge from vaginitis. It could be cervicitis as origin, or it could be endometritis. We all collect it in the vagina, but it can come from any of those 3 structures. And that has led to the whole idea or the whole principle that what we find isn't necessarily, purulent vaginal discharge isn't necessarily the same as clinical endometritis. And there is actually a poor agreement between purulent vaginal discharge and endometritis because they are different. Different risk factors, additive effects on reproduction, and terminology-wise, vaginal discharge isn't the same as endometritis. And that is something that is just important to realize. Cervicitis is a co- or independent factor in many of the cases. So what is clinical endometritis? So when we talk about clinical endometritis, we do have a mucus score of greater than 2, but we also talk about an increase of inflammatory cells that you find in uterine cytology. Purulent vaginal discharge is only the mucus score, so you don't have the cytology. Cytology, in general, you collect with a double-carded swab, and you actually have to get this through the cervix and then collect the cells. And if you look at cytological endometritis, with the different methods of doing it, brushing or flushing, across herds, across animals, you see that overall the amount of days to pregnancy is massively increased when you have any form of endometritis. So if there is any type of cytological endometritis, which is also called subclinical endometritis, you have the inflammation, you cannot detect it from the outside, so you do not have a mucus score. Subclinical endometritis is an increased amount of inflammatory cells that you find on your uterine cytology. So from hardly any inflammatory cells to an awful lot of inflammatory cells. That is the difference between a normal uterus, where you still have some inflammatory cells, but also a uterus that is affected and has subclinical endometritis. And you can understand that if there's that much difference in cellular material, that can have a knock-on effect on the actual ability of the uterus to do anything and recover. In general, we say that greater than 5% in the 5th week postpartum is what is the cutoff. If you look at the effect of reproductive diseases and time to pregnancy, as I say, the purulent vaginal discharge and cytology together have an accumulative effect. So if there's cytology only, there is an increase of 24 days from to time to get for the animal to get pregnant. If it's PVD only, 36 days, and if they're combined, 61 days. How do bacteria, what type of bacteria do we find in the uterus? Of course, it's the usual suspects, E. coli and Trichinella. But how does that relate to potentially mucus we find? The more mucus we have, the more mucus their smell is, the more bacteria there are. So we know that the amount of bacteria that are in the uterus is directly related to the amount of mucus score and smell you will give these animals. There is no correlation, however, with potential pathogens and opportunistic contaminants. E. coli, early presence. E. coli seems to be the one that kind of leads the way, and of course has a negative effect because it produces an endotoxin, and the E. coli endotoxin has a negative effect, or affects the cyclicity and the follicular development negatively. We know that ovarian follicles in animals with high numbers of uterine pathogens will grow slower and produce less estradiol. And that also leads to corpora lutea in animals with high numbers of uterine pathogens being smaller as well. So it's a direct and an indirect effect, in this case an indirect effect via the ovaries of uterine disease on subsequent cyclicity. Progesterone concentrations as an effect of the smaller cells are also lower in animals with high numbers of uterine pathogens. So the consequences are that if you have a good sized follicle, you have a healthy oocyte. But if the follicle is smaller and has less estradiol, it will be less likely to be showing heat signs and also less likely to produce healthy oocytes. So this means that there is a direct and an indirect effect of cow fertility via uterine infection, because you have disruption of the estrous cycle via the ovary effect and via the direct effect of contents in the uterus. However, we also now know that there is way more bacteria than just E. coli and Trichinella involved. An awful abundance of them. And we basically, as I said before, are now talking about the uterine microbiome and the different types of overgrowth that you can get, shifts in microbiome. So we have different cows, different colors here, healthy metritis developing endometritis and endometritis, and you see that there's crossover, but also totally different populations of bacteria present. And in healthy animals, there is even more diversity, but it's across the board. So we know now that the uterus is actually not sterile from the word go. There is a healthy population, but if there is uterine infection, there is overgrowth of either bacteria that are there already and are overgrowing, or from opportunistic pathological bacteria.